Good afternoon. I'm Katie Barnes, and I am here to present the PDSA pitch to Innovative Healthcare Concepts. Thank you for joining me. Innovative Healthcare Concepts is an integrated care clinic in Idaho Falls, Idaho, as you well know. Integrated Healthcare Concepts is currently a bidirectional or reverse integration model with goals to become a primary care behavioral health model. It would be the only one of its kind in the Southeast Idaho area. Based on our critique of the site, a specific area of improvement was organizational leaders at Innovative Healthcare Concepts will take an involved approach to increase training and consultation in integrated care. This will allow the IHCC team to meet population-based medical and behavioral health care needs and become a leader in integrated care in Southeast Idaho. During the critique of the Integrated Healthcare Concepts site, a participant completed a level of integration measure. The participants scored low in training and consultation and the leadership categories on the level of integration measure. Increased training and involvement from organizational leaders will increase confidence and buy-in from current staff and allow for easier transition for new staff. This will allow IHCC to transition from the bidirectional model to the PCBH model. So beginning with our narrative, we'll start with our aim statement. The aim statement is to increase knowledge of integrated care with staff and patients by 75% within 1 year. What are we trying to accomplish with this aim statement? We are trying to increase the knowledge of integrated care. And how will we know that the change is an improvement? We will propose changes resulting in increased knowledge and confidence, and also referrals within IHCC. Our establishing measures include implementing surveys for patients and staff and reviewing the results of these at weekly meetings. Once the staff and patients are more knowledgeable about what integrated care is, they will be more comfortable moving in that direction. And then moving on to our selecting changes. Based on the survey results, practice coaches will be hired to assist the leadership at IHCC in specific training objectives to move more into the integrated care, more towards that PCBH model. Now moving into the PDSA cycle. PDSA stands for Plan, Do, Study, and Act. The PDSA cycle is a tool used for testing and change. Using this model, professionals can test changes right in the work setting and accommodate for those as needed. It allows you to make changes easily, quickly, without additional cost. So these can be implemented by staff already on your team. You can get feedback immediately and weekly in your meetings. The next part of the PDSA cycle is starting off with the plan. So are the patients and staff aware of and comfortable using integrated care at IHCC? We propose that the answer is no, or more like a not yet. A small survey will be developed in-house by the IHCC director and the behavioral health consultant. This will be administered to staff and patients. There will be 2 different surveys developed in this part of the plan. So a 4-question survey for patients. This will measure the knowledge of integrated care. So the different questions would look something like, are patients aware that integrated care is offered at IHCC? Would they use the services offered? Would they be comfortable with an in-person introduction, like a warm handoff, to another provider? And how likely are they to stay and see that new provider they've been introduced to the day of their appointment? Um, Staff surveys will be based on questions from the LIM. So results will be based on a rating tool. So we're going to be calculating numbers based on strongly disagree would be an I, or would be a 1 in this model, and strongly agree would be a 5. So we would be calculating the answers, and then we could be rating them or putting them into a graph format. Okay, the next cycle process is the do. So the patient survey will be given to 5 to 10 patients per day with an iPad in the lobby. So we will train our front desk staff to encourage patients to fill this out after their appointments. And also our providers will be speaking to their patients about filling these out so that they can do that after their visit. The staff survey will be given to providers in primary care and mental health divisions. So these will be pretty easy to administer as well. Our director will be going around and speaking to staff and providers in that primary care and mental health division. And then afterwards, the IHCCC director will analyze and share results with the team at weekly meeting. So how would we know that there is a difference here? So higher scores would indicate an increase in knowledge of the integrated care model. You may be asking yourself, is this worth the resource? Well, the answer to that is, if you're wanting to move forward with integrated care, moving up your level of care and transitioning from the bidirectional model to the PCBH model, this is really something that you're going to want to do. And then, like I said, we could create a graph kind of plotting out those different results. Okay, the next part of the PDSA cycle is study. So we'll be presenting the findings at the weekly meeting, collectively analyzing the results, and consulting about feedback from patients and staff. Comparing answers to prediction that patients and staff are not knowledgeable about the integrated care offered. And staff and patients may be hesitant to embrace integrated care due to the lack of knowledge. So results from research and studies currently being taken show that patients, if they don't know what integrated care is, they feel distrust or apprehensive maybe about being introduced to other members of the team, such as a behavioral health care consultant. Okay, moving on to the next step, which is the ACT. So ACT would be planning for next steps based on results from these surveys. So based on the results, what the graphs are showing, what the patients and the staff are scoring. So based on that feedback, we can adapt. So this would be possibly changing the surveys, maybe like changing some of the questions around, maybe changing how it's worded, or adopt. So we could test more patients and staff, like to increase, and maybe testing like our full array of patients in the mental health division and the primary care division. And then IHCC may choose to run another PDSA cycle. And then after that, we could hire and train practice coaches for integrated care. So practice coaches are people that train and coach our entire team to make that integrated care more of a smooth transition for everyone. So now moving to the reflection, what did I learn from this project? I learned quality improvement can start small and be carried out by our staff in-house. Starting small and measuring those small objectives can lead to overall change. What was the most challenging part of this project? So frankly, all the concepts that I learned in this project and pretty much the whole entire class were brand new to me. I'm very brand new to integrated care. Integrated care is really not being embraced, I guess, yet in the state of Idaho. So it felt a little bit like flying blind with just this little bit of outline and just the little bit of things that I have learned. This is my first semester in the doctoral behavioral health program, so it was just overall everything was a little challenging. So identifying 2 areas of quality improvement for more support or guidance during time in the program. And so I put, I would like more information and training in actual assessment measures. So the critique of the site assignment referenced staff patient satisfaction surveys such as the SIROTA and Press Ganey, but I could not find any information on this when I searched on either like the library, website looking for research or just on Google. Um, so yeah, just really helpful to see what assessments are already out there for primary care and mental health sites, especially sites like in the areas that I live in. These sites are really wanting to maybe embrace integrated care, but they really don't know how, and having some already established assessments would be helpful. I did find some online. I found one from Harvard actually that I downloaded, but they all kind of appeared to be created by the individual clinics um, that they were like kind of established at. So I think that maybe just finding some and modeling them to the clinic would be helpful. But yeah, if there's already established ones, that would be great, because that was another thing that IHCC had asked was if there is an assessment that they could already utilize, and I had some trouble finding them. So any reflections I felt compelled to add was I felt that the listserv conversation and the Yellow Dig platform itself was really helpful for discussing topics, especially topics that seem to be kind of like hot or new in our industry. So thank you so much.